Okay, so welcome everyone. Thank you for coming today. So today I'm going to talk about traditional Chinese medicine and traditional Japanese medicine and the differences between the two, and also a little bit about safety in clinical practice. So I have a question for you. So can you tell me how old is Chinese medicine?
200?
200. Very close. Well, a little bit more than 200.
What? I know.
4,000. Yeah, it is 4,000. Very good. So over 4,000 years old. Very, very old. And we'll talk about in the timeline of things how old that really is. So, welcome. My name is Dr. Chris Eddy. I'm a doctor of Chinese medicine. Now, we can use the title doctor as long as we say we're a doctor of Chinese medicine or osteopathy or philosophy or whatever you are, as long as you don't hold yourself out to be a Western medical doctor. So, I studied Chinese medicine over 20 years ago at RMIT University in Bandura, and then my 5th year was an internship in Nanjing University. And Nanjing is just a little town of about 80 million people, just inland from Shanghai. So you can see Shanghai is quite close to South Korea and Japan. So we'll talk about how the medicine went through the peninsula of Korea and into Japan there. Okay, so that's me needling someone in the face, probably around about 2002. So Chinese medicine pretty much relies on a pulse diagnosis and talking and asking questions, on tongue diagnosis, and then using all that information together to prescribe herbs, sometimes cupping and sometimes little needles called acupuncture. Japanese medicine here is a lot about asking the right questions, but also the Japanese developed more of a abdominal diagnostic system. So you press on different points of the abdomen and that tells you about the disease state of the patient, and then you prescribe herbs. More herbs are more popular than acupuncture in Japan. Western medicine, on the other hand, is more about using modern diagnostics such as blood tests, X-rays, and things like that, and vital signs. And then surgery and Western medical drugs is more of the therapy with that. Now, talking about Oriental medicine and a bit of timeline, just to give you a bit of a time and space. So 4,500 years ago, the Great Pyramid of Giza was built in Egypt, and then maybe 1,000 years after that, between 3,000 and 4,000 years, China started developing their own medical system in the Shang dynasty, and then a couple of thousand, maybe 1,000 years later, about 2,500 years ago, 2,200 years ago, during especially the Han dynasty. The foundation was really set of Chinese medicine. So a lot of the classical books that we still work with today were written and developed and created a system of acupuncture and herbal medicine. Maybe 400 years after that, Japan and China were trading and exchanging ideas. This was during the Kofun period in Japan, and that's a burial mound that was quite classical for that era in Japan. So China and Japan traded and introduced some medicine at that time. But it probably wasn't for another 300 years, perhaps later, around about 400 to 600 AD, when China really introduced the full structure of Chinese medicine into Japan, which then over time became what's called Kampo, which is more of a Japanese system of medicine. And then over the next 1,000 years, things developed quite a lot. Now, around about 70 years ago, there was a system called TCM, which is what we practice today, traditional Chinese medicine, not what I practice, but what's taught in universities. Now, not a lot of people know, but it's only 70 years old. So Mao Zedong, during the reign of China, created a communist government, and he saw it as, even though he didn't use traditional Chinese medicine himself, he thought it was a national treasure and also a cheap medicine to teach people in the country. Now, we thought it was 4,000 years old, but then something crazy happened. In the Austrian Alps, about maybe 20 years ago, they found an Iceman, 5,300 years old, with 61 tattoos on his body, all on acupuncture points. Now, this is in Austria, a long, long way from China. So we're a little bit confused now, because that's a lot older than we thought originally it was. So very interesting. Actually, Brad Pitt's got a tattoo of this guy on his body. I don't know why, but anyway. So a little bit of a confusing point, but an interesting point nonetheless. We're still confused by it. Now, a little bit about Chinese medicine. So Chinese medicine is very much based on macrocosm and microcosm. Now, what does that mean? So that means that, let's say the sun shines down on the ocean, and it warms it and it evaporates it. So the water goes up into the sky, makes clouds, and then that causes condensation, and then what's called precipitation, which means rain. So the water gets evaporated, sucked up into the air, makes a cloud, and then rains down, gets stored in lakes and groundwater and then circulates around and around. So the Chinese thought this is a little bit like the body. So in the upper part of the body, you've got the heart, and the heart creates heat and pumps blood, and then the lower part of the body, you've got the kidneys and the bladder and the water, and that circulates around. And when you have disease states, there's a bit of a problem with this natural flow of things. So again, gas and liquid. So you can have a gas state and a liquid state, and there's a change of matter. Now, I'm not going to go into too much detail here, but just give a little bit of a snapshot of Chinese medicine, how it works. I've got the basic, you've probably seen the yin and yang symbol here and there, tattoos and rings and all kinds of terrible things. So basically what it means is yin and yang is just the very basis of things. It's hot and cold, or dark and light, or excess or deficient. It's a polar opposite of things and how they work together and they flux together. Then a little bit deeper, then we look at dividing the body into blood diseases or fluid diseases or metabolism diseases. And then more complex, we have more of a 5-element system, which I won't go into, but basically things become more and more complex as you understand things in terms of disease. Now, what's a typical Kampo, so Japanese Kampo medicine examination? So first the patient will walk in and they'll be asked a lot of questions about their health, about their temperature, their stool, urine, their appetite, all kinds of things. And then they'll be pressed on their abdomen, they'll look at their tongue, and then they'll check their pulse, and all that information will equal a formula, and they'll be given some Kampo medicine, which is herbal medicine. So again, diagnosis and treatment. Generally, it's the pulse, plus the abdomen, plus the signs and symptoms, plus the disease, so catch a cold, equals the formula or the acupuncture points. There's a lot of information there, but basically that's a little chart I drew. So let's say you've got a headache, or you might use those two formulas. If you've got some back pain, you might use those two formulas. So let's just look over that again. So let's say you've got irregular menstruation, chill feeling, edema, fatigue, plus your abdomen is a little bit tense, plus your pulse is a bit wiry, your tongue's a bit swollen and wet, you might use that formula. So it's quite straightforward. So in Australia, the qualifications that you need is a 4 or 5 year bachelor degree from a qualified university, or a 3-year master degree, and then you need to register with APRA, which is the Australian Health Practitioner Regulation Agency. So they oversee things like chiropractic, dental, osteopathy, paramedicine, pharmacy, etc. So we're all under the same banner. So it's a proper regulation. You need about 1,600 hours of clinical of study hours, and then also 500 hours of supervised clinical experience as well. So that helps us prevent getting problems. So what are some of the dangers of Chinese herbal medicine we've found with dysregulation, with not regulating things properly? So you might get contamination from bacteria or viruses. It might be poorly labelled, like how many, what's the dosage for different ages. Adulteration, it may have included drugs or paracetamol or things that aren't meant to be in there. It might be contaminated. There may be toxic herbs that shouldn't be in there, or endangered species such as rhino horn, things like that from animals that are getting culled in the wild that are already endangered. The other danger is acupuncture. You have to be well trained so you don't puncture organs. So there have been cases in the past, which we'll talk about. So in the last 40 to 50 years, there's been about 90 deaths from acupuncture recorded worldwide. Now these were all from untrained people, and they were basically from puncturing organs. So it's, it shouldn't have happened, but these were untrained people doing silly things that would never happen with a well-trained person. Those are a couple of cases there from herbal medicine as well. Again, they were just people being cowboys doing things that they shouldn't. If I compare that, let's just compare things to iatrogenic death, which means death from medical intervention in Western medicine. So in the US alone, about 250,000 deaths per year happen from Western medical intervention. So we've got 90 deaths over 45 years, and we've got 250,000 deaths. So and even 50 people die every year from paracetamol in Australia. So the OHS responsibilities are quite laid out in the OHS manual in Victoria 2004. So sections 21 to 35 to 38 will explain about the obligations of a Chinese medicine practitioner to their employees to the patients and the responsibilities and hazards that they must overlook. So thanks so much for listening today to all these things. I hope that's enlightened you a little bit more about Chinese medicine and some of the things that could happen and why they shouldn't happen with proper education and proper overseeing of these people. So I'm just wondering if you had any questions for me today. Yes?
Does Chinese medicine sometimes make you sick?
Does Chinese medicine sometimes make you sick? So usually a person will come in when they're sick and we want to make them better, but very, very rarely, like 1 in, 50 people might feel a little bit sick from Chinese medicine, or if you get the wrong formula for the person, that might make them sick. And some people just have strange allergies that you can never foresee. So sometimes, people get sick with drugs, with food, with lots of things, but yeah, sure, definitely, it's medicine, so it's strong and you have to be careful of it. So yeah, people can get sick, but more times than not, people will get better rather than sick. Yeah, good question. Any other questions? Yes.
So you described all the possible dangers Chinese medicine can cause. What's the best strategy to avoid all these dangers?
Strategies to avoid the dangers?
Yes.
Yeah. So I think a sterile environment, so a very clean environment. The patient has to always wash their hands. I'm an educator as well, and I always, students will fail if they don't wash their hands, even before the exam. So that's number one, is hygiene. Using sterile equipment, making sure the patient has eaten something if you're doing acupuncture so they don't faint. Having a nice, calm, clean, accessible room with no trip hazards and things like that. In terms of herbal medicine, it's really just using certified herbs that are OST-L, so listed and registered herbs that are safe and have been tested by the TGA, Therapeutic Goods Association in Australia, and to do your best, do a thorough investigation to make sure you're getting the right formula for the right patient. That's about as much as I can think of at the moment. Yeah.
Thank you.
Yeah, great. And one more question.
Why are you a doctor?
Why am I a doctor? I like helping people, and I enjoy the interaction with people and making people feel better, and then when people come back and say thank you so much, I'm so much better, you fixed my problem. It's a good feeling. I like it. Thanks for that question. And thanks for listening to my presentation. Thank you very much.